I'm going to move straight on to our next speaker, who's Dr. Sarah Knight from the London Spinal Injury Centre at Stanmore. She's a clinical scientist there and also an honorary professor at UCL. She studied engineering at Cambridge, and she has a PhD from Queen Mary in Westfield at the University of London. And she really focuses on clinical research, which can be translated into clinical practice. And she's been involved in the development of some novel medical devices as well. So Sarah's going to tell us about her project around UTIs. Sarah.
Okay, thank you. And again, thank you for the opportunity to tell you a bit about this project, and also for the funding that's hopefully going to enable it to actually go ahead. So the title of the project is a feasibility study of intravesical gentamicin in the prevention of recurrent urinary tract infections in people with spinal cord injury. And we're hopefully going to recruit patients from the London Spinal Cord Injury Centre here at Stanmore. And my co-investigator is Mr. Rizwan Hamid, who's our urology consultant here. So just a little bit of background to the project. As Peter and Eric both described earlier, after a spinal cord injury, the normal bladder function is often disrupted, and this often means that people lose voluntary control over emptying their bladder, and that means that they may need to use a catheter to empty the bladder safely and effectively. And catheters can either be, as Peter mentioned, intermittent catheters that you just pass in and out of the bladder 5-6 times a day, or what we call an indwelling catheter, like a suprapubic catheter that stays in the bladder the whole time, draining it. The main problem with catheters is that for some patients, they can lead to recurrent urinary tract infections, because ultimately they're a foreign body that's being introduced into the bladder. And urinary tract infections can cause pain, malaise, incontinence. Obviously, this leads to then a reduction in quality of life. It can lead to increased reliance on oral or intravenous antibiotics. They can lead to hospitalization and therefore increased healthcare costs. Obviously, there's an ongoing issue with antibiotic resistance. Taking lots of antibiotics can obviously change the gut microbiome, and in recent times, the importance to your general health of having a healthy gut has become more apparent. And recurrent urinary tract infections ultimately can lead to kidney damage and permanent. So we're always looking for a way to try and reduce recurrent urinary tract infections. So that's where the idea for this project came about. Gentamicin is a widely used broad-spectrum antibiotic that is often used to treat or prevent urinary tract infections, but normally as an intramuscular injection. But there has been some studies that have looked at instilling gentamicin directly into the bladder, and it has been shown in other patient groups, not spinal cord injury, to reduce recurrent urinary tract infections. The bladder wall is a fairly effective barrier against drugs entering the bloodstream, so therefore we hope that just placing it in the bladder can reduce some of the side effects of antibiotic use. For the project, which is a feasibility study, we will teach patients how to instill a gentamicin solution into their bladder at home over a period of 12 weeks, and we'll be doing regular follow-up questionnaires, urine samples, to see how they progress with respect to urinary tract infections, and also acceptability of using gentamicin at home as a washout to prevent recurrent urinary tract infections. So in the next slide, please. So just a brief overview of the protocol. It's a 2-year feasibility study. We will be recruiting patients with a spinal cord injury who use a catheter to empty their bladder. We will include people who use intermittent catheters or who have a suprapubic catheter. Our patients will be identified from our urology clinics here at Stanmore, and we would like to recruit patients who currently have recurrent UTIs, which we're calling more than 4 per year. So I've got a little flow chart on the screen at the moment, just showing the stages when somebody enters the trial. We'll do some baseline assessments, which would include a history of their urinary tract infection prevalence, urine samples, some questionnaires like the neurogenic bowel symptom score and the neurogenic bladder score, some quality of life questionnaires, and some perianal swabs. Then we'll have the training where the research nurse who will recruit onto the trial will teach patients how to instill the gentamicin into their bladder and give them a program for how often they need to do it, and give them the prescription so that they can get the drugs from their local pharmacy. Then it will be a 12-week period of using the intravesical gentamicin, and at week 6 we'll do some more assessments, again urine samples, questionnaires and the perianal swabs, and at week 12 again further questionnaires about how often they've had urinary tract infections in that period, and then again following 12 weeks after that some more samples, questionnaires, and also an acceptability questionnaire regarding how they found using intravesical gentamicin at home. Next slide, please. So hopefully the potential benefits to patients and clinicians. Ideally, we'll see a reduction in urinary tract infections for people with spinal cord injury. It will give the clinicians another treatment option for people with recurrent UTIs. And if we get positive results from this feasibility study, we would like to apply to the NIHR for a much larger multi-center randomized controlled trial of this use of antibiotics in preventing recurrent UTIs. So yeah, we're hoping to see a decrease in infections, decrease in incontinence, decrease in oral and IV antibiotic use, and a decrease in hospitalization, and an increase in quality of life, increase in bowel health, independence, and hopefully protection of the kidneys.